The tough customer, handling challenging client behaviors. For mental health workers, important skills, understandings, and principles related to dealing with challenging client behaviors. Today we're going to talk about combative client behaviors, things to keep in mind, an example, and some general principles. We will be getting into some more details, but as a very general overview, it's important to look at what we should not be doing, what are common mistakes. For example, engaging in the content. Besides not engaging in content, other unhelpful things we shouldn't do will hopefully become clear as we go. Important reminders. It's important to remember that everyone is unique and that the best way to address a problem is to first understand it properly. 10 different therapy clients engaging in combative behavior could have 10 different unique diagnostic configurations that explain that behavior. The client may simply be forceful and assertive, and due to cultural differences, we misinterpret that behavior. The client's anxiety might be too high, and the client might be discharging anxiety by being combative. This is quite often the case, but it's important to be open to other explanations as well. We, as therapists, may have genuinely done something to warrant a strong reaction of anger, though how the patient deals with their anger is, of course, of great importance. A client who is normally timid and passive, becoming more feisty, for example, could represent progress. So instead of guessing or making assumptions, we carefully assess and we look at the psychodiagnostic dynamics driving the behavior. A common denominator in combative behavior is that the client's anxiety is too high and they're often engaging in an interpersonal conflict rather than attending to their intrapsychic conflicts. Here, there's a very good chance that there is a projective process at work and the client is actually at war with a projection rather than seeing you as you actually are. A thorough look at the many different unique reasons that could drive combative behavior is outside the scope of this video. Instead, here we will focus on combative client behavior of the self-defeating kind that clearly interferes in the treatment and risks derailing and sabotaging the therapy. The causes are secondary, but they generally involve excessive anxiety, primitive defenses such as splitting and projection, as well as displacement of conflict. Depending on how incapacitated the client's cognitive and self-reflective functions are at a given moment, we tailor our interventions accordingly. The more incapacitated the client is, the shorter and briefer our communications. And if the client is only minorly incapacitated and cognitively disorganized, we can offer a bit more explanation and elaboration to our interventions. When dealing with combative clients and the projections that are often involved, as a general principle, it's more important how we act than what we say, although that's very important too, especially with clients that mainly communicate through enacting old role configurations, more so than communicating symbolically through their words. Acting in ways that are different than the projection goes a long way to undo projections. It's generally helpful to be calm but firm and clear about the limits of what we can do. Compassionate, firm, even tough, and fair as a non-defensive, is an often appropriate stance, where we don't allow ourselves to be dominated, nor do we try to dominate the client. Let's take a look at one way that this can be done. Here's an example. In this hypothetical situation, the client shows skeletal muscle activation and only minor signs of cognitive disruption, so our intervention can be a bit longer than it would need to be if the client was more disorganized. Notice that as the behavior continues to escalate and deteriorate, the therapist's comments become shorter. The hypothetical client shouts and denigrates the therapist. To engage in content at this point would go nowhere. In your current state of mind, you're seeing me as the source of all your problems. I'm open to the idea that I may have stepped in it somehow and that you have good reasons to be angry with me. But we can't even get clear on that right now, as this is not a conversation anymore. And that means I can't help you. We have to be able to have a conversation if I'm to be able to help you and see what my role might be in your pain and agony. The patient continues to shout and denigrate. You're still combative. Nothing I say right now will penetrate and be helpful. I can't help you when you are like this. I want to help you, but I can't be of any help to you when you're like this. You are an imbecile. I hate you. I hate you. I hate you. You're still doing it. You're treating me like I'm your punching bag, and I still can't help you when you are like this. This stance is repeated until the patient either calms down or storms off. If the patient does calm down, ask him to just explain what has angered him. The principle to heed here is that engaging in content will lead nowhere, nor will becoming defensive. A firm stance that nothing productive will happen as long as the behavior continues, while remaining open to the possibility that we really are in the wrong about something, is key. In closing, as mentioned earlier, there can be countless flavors and types of client combative behaviors. This was but one example. In this example, the therapist remained firm but did not retaliate, which is often an appropriate stance. I mean, retaliating is never appropriate, but depending on the client, the kind of firm stance can vary and take on different tones. In some cases, it may even be appropriate for the therapist to go silent and say nothing. Keep in mind that just as the client is free to have their opinions, you as the therapist are free to have yours, and you don't do your client a service by allowing them to pressure or bully you out of your own views. Staying open to seeing things through the client's eyes while not abandoning your own views is important. Some clients cannot handle two minds in the room, so to speak, and will either try to void their own selfhood, leaving only you, or try to bully you into agreeing with them, leaving only them. Our interactions should model what leaving room for two minds can look like, though there are cases when it's important to simply mirror back to the client their position without offering a counter. If that's what you think is right for you, then you should do that kind of intervention. And coming up next, dealing with defensive compliance and defiance. No easy task, just like walking the plank.